position up above our waist, and we're coming on in. We don't have to bump our butt, but we do need to keep the OR door closed.
Okay, I will shut it once you're
In
in.
the hallway somewhere.
Oh.
I will shut the door. Trace is not dry all the way yet.
Then I'm going to don my gown. Gloves. Thank you.
Do you tie the inside too for you?
Whichever. So I'm closed glove right now.
Just 1 second here. Okay.
Standing away from your table and got my gown over my hands and closed glove. You do not want to bring your gloves over there. You don't want to bring your gloves over here. You need to glove yourself at the sterile field. So opening this with our hands completely covered by our gown. I'm going to start with our right hand first. And I'm going to go thumb to thumb. Let's kind of stick my sleeve into the glove there. My thumb is here, my glove thumb is here. I'm just going to take this, I'm just going to pull it on down. Sometimes things stick, and that's okay, you can always fix it later. This little guy I really want to fix right here though. I'm going to use my thumb in there, and you're just going to pull. This sleeve is going to help protect your hand here, so you're going to want to always have your glove covering this sleeve. Second glove goes on a little easier. There's my thumb in there. Here's my thumb here, thumb to thumb. You're going to put your sleeve into the glove. I'm just going to pull it on first. Nice and easy. So I double glove, but I don't double glove until I'm all done with my setup. Just because it's less on my hands. You can throw this away. My garbage is closed. We want to keep our movement to a minimum here. So now what we want to do is we want to set up our instruments. Our instruments are right here. It's nice, it's important that we have somebody in the room. I'm just going to kind of move these. These are going to go on this side of the table. So I'm going to move these once to this side of the table. My instruments I'm going to have here, so I'm going to drape this area here. And this is where I'm going to very carefully come over, grab my instruments, and put them on my table. Now I can't touch that, so somebody has to be in the room to get rid of it, and you don't want to leave it in the room.
I will take it out.
So now I'm going to gown and glove Teresa. We have our gown here. What we're going to do is we're going to hold it, and we're going to let's let it fall. We're going to take our hands, we're going to put them under, hold on, the gown, so we're not touching her at all. We're going to just let her slip into the gown. And she's going to walk forward towards me, and I'm not going to touch her, and I'm going to just take her hands and poke her fingers through, so we can see them. So keep your hands on up, Teresa. And what size gloves do you wear?
6.5.
The 6.5. So I'm going to glove her with 6.5. So when we're gloving, we're going to open up our package. We're going to start with the right hand. We're going to take our glove. We're going to pull on the glove. Make it nice and straight. You're going to tuck your fingers underneath. You're going to make sure that thumb is pointing towards her. You're going to tuck your fingers way deep. You're going to pull your thumbs out. And you're going to let her reach her hand in. And look how beautiful that was. Now for the second glove, it's a little easier. You're going to take your glove, make it nice for your doctor, or whoever you're scrubbing with, and she's going to take her hand, she's going to pull on that, and that's how that goes. And if you like them, you gently release. You don't do that. And then we're going to throw this away. Okay, my first thing that I like to do is get my mayo stand ready.
So then when you're waiting, you have to wait with your hands above your waist and all that kind of stuff at
Right.
your chest or cross.
So if we're in the OR. Hello, good morning.
Just coming in to check the.
Therese is gonna come on over here. We're always gonna want to have our stomachs towards the table. We don't want to turn towards the bed. And Teresa and I, we can touch each other because we're sterile, but we can't touch our faces. We can't touch anything around our neckline. We just can't touch anything unless it's right at our tables,
Height.
height. So I'm gonna turn Teresa. So she's gonna stand back. Go ahead and stand back. And I'm gonna grab her bag, and then she's gonna spin. Turn, turn, turn. Be careful of the bed. And there. Gotcha. And then there, you can throw that away.
Put it in that box. It's fine. I'll get rid of that in a minute.
And then we're gonna turn. And you don't want to tie that too tight because you have to break out of that. Okay, so now we have our table. I'm just gonna start setting it up. The first thing I like to do is dress the Mayo stand. The thing that you have to remember is what your patient is doing. And if your patient is not in an emergency, you have a little extra time. But if your patient is in an urgent way, you're gonna wanna make sure that you get your knife handles loaded as quickly as possible. But our patient's doing okay. So we got here, it says right hand under cuff, left hand under cuff. We're gonna place our left hand here. We're gonna place our right hand here. We're gonna go over to our Mayo stand. I'm gonna place my foot on the Mayo stand. I'm going to wiggle this on. Once this is on, you don't want to go down and touch the bottom. You don't want to touch anywhere but on top of it. So I'm going to tuck and make it nice and flat. And I'm going to dress my Mayo stand. I'm going to take a towel and I'm going to place it on the Mayo stand. There we go. What I like to do is start with my instruments. Let's go over here. Your instruments come in this nice little cage here. And the first thing you want to look is to make sure that it's all sterile. So you can take our tab and look at that carefully. And yes, we have an accept here, so I'm going to put that here. I'll just take my instruments out. I'm going to take them out of the ring forceps. One of these is going to go off the table onto the nurse. So I'm going to look for my towel clamps. We're not in a huge hurry. So I'm just going to set up my table the way I would for a routine C-section. I got my bag here. I'm going to take my towel clamp. Now I don't have to walk away to throw things away. I have my garbage. I have my instruments. I set up my table really easy, pretty easy here. A lot of people will roll a little towel and make a snake. They'll take a towel.
I'm gonna back up a little bit.
And they'll roll. And they'll take their towel and they'll put it on their sterile field or their Mayo stand, and they'll kind of make a snake like that, and they'll set their instruments up. I'm just going to show you a simple way to do it, so that way if you're not experienced, or if the doctors need to reach something, it keeps it simple. You have Penningtons. So you have 6 of your Penningtons. They're going to go here. You got 6 Penningtons. Then we got our Kelly clamps. We have 4. These come open. You need to close them. So they're closed. I'm gonna put my Mayos here, or my Kellys here. And then similar to Kellys, you have Mayos. They're just a little bit bigger. We're gonna tighten those up, and I'm gonna put them right across for my Kellys. We're going to have cokers here. We have 4 cokers. I've tightened those up. I'm going to put my cokers over here. I'm gonna put one Alice on the table because we really don't need her for much. I want to put the other one over here, and I like to always have my instruments exposed so it's easier for the count. I've got 2 needle drivers. They don't go on the Mayo stand. They're gonna go over here next to my sutures. And I have 5 scissors. Mind you, I know what's in this count, but you should always use your count sheet. One person should be counting in, and anytime you switch with your scrub, you should always count out together because you're responsible and you always need to use your instrument sheet. So I have my bandage scissors, I'm placing here. I have my curved Mayos. I have my suture scissors. Turn them this way. I've got another scissor. I'm gonna put these on the baby bed. Hello, NICU nurses, your scissors coming over.
Scissors coming over to the baby
Scissors
bed.
coming over. Sorry. There's that. Okay. And then we have our Mets and bottom scissors. I'm going to put the bandage scissors last because we really don't use those for too much. So now we've got that. We don't need this. We're going to throw it away. Remember, I'm going to try to move everything just one time on each side of the table. I threw this over here because we had more room and it wasn't going to fall off. But now I've moved it over here and this is where it's going to live. So now we have our sutures. Our sutures, I've got a little, if you don't know your doctor's preference and you're not completely confident in knowing your sutures, you can kind of cheat a little. I write my doctor's preference down and just kind of hang it on a piece of foam tape on the wall, and that way I know what order they're going. And I do it. I start by what they're going to use first. This is the uterus, and she's got a 2-chromic. She's got an ovicural. She's got another 2-chromic, and then she's got, for her skin, she's got her Keith needle, her Polysorb. I'll put that there. So you've got our order. So there you go. That's kind of, so you don't have to, so if you get nervous, you have an idea what you're doing. Next I'm going to do, I'm going to set up my bowl. In the bowl, we're going to check for sterility. We had another of these little guys here, I just threw him away, but we checked to make sure he's good and sterile. So he is, we're going to throw that away. You always want to be mindful of sterility in the OR and always check to make sure. I like to set the bowl up prior to the surgeon coming in, because when everything gets started, you can just hand this over, and what this is going to have is your light handles. It's going to have your suction tubing. Get rid of this guy here, we don't need him. We'll end here. It's also going to have your yank hour, which is right here. I don't even connect him because when you do connect him, he's here, but the assist can do that, and if you connect him, he might fall out, so I just tuck him in here nice. To hold these guys in there on the surgical, on the drape of the patient, they're going to use a towel clamp. So I'm just going to put a towel clamp there too. The other thing that we're going to use in this right away, I mean this happens in a matter of seconds, that's why it's nice to be ready for it, is your bovie, and you're going to check your bovie tip. That's considered a sharp and it will be counted. He's going to go in that bucket too, because he's going to go right on that field as soon as the patient lies back from their prep and they're draped. This is what I was looking for, our little container for our bovie. And I'm just going to stick him right in here where he lives. There we go. He's going in there. And then, there's one more thing I'm thinking about. I'm thinking about the little scratcher they use to scratch off all the blood and things that happen that get on the bovie tip. Don't put it back here, that's the back of it. You're going to put it on the front. But I've also seen surgeons remove it and put it on their wrist or somewhere else. And the surgeon has all sorts of, they all differ from where they're going to place their bovie on the patient. Some like it close, some like it next to them, some like they'll place it. So now, when your patient's straight, all you have to do is hand this over to them, and then they're busy doing this. It takes them like a minute, and they love to do it, so just let them do it. So in here, what you don't need these pads, and you don't need this gas kit. So I'm just going to hand this off to you, and then you can just kind of throw it over there, but don't touch
Drop.
anything.
Drop it somewhere.
Yeah, just drop it somewhere. So, the next thing I'm going to do, I'm just going to kind of empty out this bucket. What's in this bucket? This is where your normal saline is going to go, and the circulating nurse is going to bring in your warm saline, and you're going to look at the bottle and double check it with her. And I'm going to place it right here because this is where we're going to saturate our laps. Remember, you want it 2 inches away from the corner of the tables. You don't want it too close, but you don't want it too far away because they're going to pour the water and you don't want them to get the water everywhere. And we've got our little bucket here. We use this for a couple things. You can measure it. It's got the measurements right here in mLs and ounces. And I place it right here because if we use it for irrigation, they're going to pour the water in there, and that's where we're going to keep all our irrigation stuff. And this is our pool suction. They use this in lieu of the yank hour when they go into delicate tissues. They don't always use it, but if they do use it, it's usually during the time they irrigate, so I'm just going to keep it right there. It's okay if it sits in the water. Now we have our medicine cup. Unwrap him. I'm just going to put him right there. So these are our laps. We don't want to take our laps out of this guy here, the way it's wrapped up, until our circulator is in here and we count them together, one by one, seeing each one individually. So I'm just going to keep these guys here, because we don't need them right now, but we want them out of our way. I might clean up this side of the table just a little bit. So we've got our surgeons coming in. These little white towels, we really don't need them for anything, but I have had circumstances where they've come in handy, so I just kind of put them on the side of the table. I'll get rid of this towel because we don't want him anymore. I'm going to set up for my surgeons. When they come in, they're going to be reaching for the towels, and you don't want them reaching across your table, so you want them nice and close. I will probably gown my physicians or midwives, so I will be reaching for them, but if they need to come in and do their own gloving and gowning, it's best to have this close. I'm just going to kind of put all my gowns right here. People do this different. Oh, we just lost one. People do this different. Sometimes they for each position they have them like this, but you don't know who's going to come in first, so I just kind of put everything left out like this. Everybody's kind of wearing the same size gloves. Alrighty, so now we have things in this bag. Things that are in this bag are your blades, your cord clamp. We're gonna go through all those things individually. We have for our cord blood. All this happens fast when the baby comes up, so you want this tube to be accessible. I just kind of place it inside this little cup. I use this cup for lidocaine or any medications, which always have to be labeled if they do decide to use those. I use this cup for my cord blood because the blood coagulates really quick and it just makes it difficult to clean. So when the cord blood comes out, I put it in here and any medications in here. But it still goes on the table and it's something that is counted. We've got our bag here. I'm going to just pour everything out. We don't need this little plastic bag. We're going to get rid of it. And what's in here, you got your blades, and these are pretty important because we want to have these loaded. First thing, one of the priorities on the table in case the patient needs to have their C-section go a little bit quicker. I'm going to go ahead and open these, and the way to open them is you just peel them open. You be very careful because they're sharp. And I drop them on here. And these are always going to be.
Oh,
you know, will you get a mask and turn off the baby thing warmer.
I'm gonna drop my sterile drugs.
And these are going to be size 10
Oh, you were back
blades.
here already. What kind of two syringes?
So there we go. And those go in my garbage. And then we have our sharps container.
And then
Which one do you want first? Does it matter?
So there's little stickies on this sharp container. I'm going to unstick the little stickies here.
in there.
And when it comes to my sharp container, I try to have it up a little bit higher on the field.
Looks like you got a little more in there. I don't know if it's gonna matter.
Oh, just press the yellow button.
Okay.
Yellow. Silence.
Should've done
Silence is golden. I know, that doesn't really work very well.
Yeah.
All right, so we've got our sharps container. It's on the table. It's magnetic, so whatever you put in there is going to stick if it's metal.
Okay.
So just be aware of that.
I overfilled.
So we're gonna load our blades here.
So I'm gonna go ahead and bring
Our
this
knife
over.
handles are gonna be in
Yes.
here.
Do you want her to have,
Once again,
30 or
we're gonna
15?
check for sterility.
Just one vial.
This is
fine.
sterile.
Or one of those little packets.
15? Okay.
I'm gonna put this in here. We're gonna open this up, and what you have in here are your pickups, your also called forceps, and you're gonna have your knife handles. We're gonna take our 2 knife handles out, and we're gonna load these. The way to load your knife blade is to minimize how much you handle it by hand. You're gonna take your blade, you're gonna take it right at the tip here to avoid resistance here, because if you have resistance there, it's a little more difficult to load. You're gonna take your knife blade, and you're gonna just pop it on. There's one. And there's 2. So safety in the OR. Pop this on here. Oh, wait. Might be a little bit too low, got resistance there. Sometimes it takes a minute.
And just because we have someone, you would take the pickups and put them on the table and then you're pretty much done with the setup?
I'm sorry. Oh, because it's patient? Okay. So we have our blades here. They're going to go next to the sharps. And so we have our hypos. These are going to be counted. I think she's going to be a few minutes. We have our cord clamp. We're going to throw it over here on the bed. So normal saline is going to go in here. So once it's here, we want that to be labeled. You want all your meds, including your saline, labeled. All right, so then we got our pickups. What we have here, we have our Bonnies, we have our Adsons. We don't need our Adsons because those are for later. We're going to throw these here. Everything I want to be able to see. We're going to put our pickups on the table. When I put my pickups on, I put my ones with teeth, I put them up. And the smooth I keep down. They use the Russians a lot, so I keep those close. You got 2 with teeth, so I just stick one over here. And here, you've got your retractors. She may or may not use the bladder blade, so I'm going to keep that over here. I'm going to put 1 Army Navy or Goulet and 1 Richardson on the table. I'm not going to load my sutures quite yet, but this is our needle driver. I'm going to keep that close right here. We have 1 sponge stick that's going to go right here. And they like to have a marker on the table as well, so I like to put that right here. And then we're going to keep this close for cord blood just in case we need it. The little suction, you don't usually need to use it if we get the cord blood in the tube fast enough, but sometimes it coagulates. And then the nurses like to use this for the cord blood. It's not really necessary, so I just keep that on the back of the table. We've got 1 extra towel clamp. I like to have everything so you can see it. It makes the count easier. We got a Babcock. We're never going to use that unless there's a tubal. We got a couple extra retractors here. Once I'm done with my table completely, I'll load up my first suture. So basically, without too much fuss, we are ready for surgery. When the circulator comes in, she'll pour our saline, we'll count our laps, we'll keep this close over here for our pediatrician, and we'll gown and glove our physicians as they come in, and we're going to stand here, not touching anything, with our tummies to the table and our hands to our chest. And that's it.